Good morning, good afternoon, good evening to you all, wherever you are in the world, and welcome back to the Thursday Talks for our second Thursday Talk under the new branding of Connexus. So for those of you who are new to the Thursday Talks, my name is Jack Farrell, and I am the Manager for Partnerships and Strategic Innovation at Search for Common Ground. And I'll be your host today, joining from lovely sunny London, which is not a regular occurrence. I'm delighted to welcome back Hilde Deman, who's the Senior Program Manager in Global Programs, and Samah Abdalrahman, Data Management Officer at Search for Common Ground, both based in Brussels, who are going to lead a discussion on the gendered impacts of the COVID-19 pandemic in conflict-affected settings. Now, just a note, if you have a question during today's discussion, you can write it in the question function or the chat function of your GoToWebinar dashboard, and we will make sure to address it during today's session. I'm now going to hand over to today's guests, Hilde and Samah. You're very welcome back to the Thursday Talks. I hope you're doing well, and feel free to take it away when you're ready.
Okay, thank you very much, Jack. Jack, can you just confirm for me that you're seeing my screen?
Seeing your screen, you're coming through loud and clear.
Great, thank you. Great, thanks everybody for joining us this afternoon and giving a chance to my colleague Samah and myself to present data and findings from a recent report that we published at Search. And just a bit of a quick overview of the research that we've been conducting. So we've been conducting a research for, I think, about over a good year now, Samah, where we regularly collect quantitative data across 6 countries. These are countries where we're also doing pandemic response programming. And we've started to look early on. We were interested basically in 2 different dynamics here. On the one hand, we're looking at how pre-existing conflict dynamics in these 6 places play out in how the pandemic evolves and how people respond to their government's response to the pandemic. And also how, on the other hand, how the pandemic can exacerbate, or perhaps on the one hand exacerbate conflict dynamics, or on the other hand perhaps provide opportunities to unblock certain conflict dynamics. So that was the purpose of the research. We've issued, if you look at the links that we've highlighted below, we have issued country reports over the past year for each of these places. And we've also started to look at what are some of the more global trends that we're seeing across the 6 countries. And so a first report that we published last year looked specifically at how the pandemic was impacting vertical cohesion, so people's trust in their government. Another was looking at horizontal cohesion, so how the dynamic between groups across divide was being impacted by the pandemic. And then the third one that we now published was on the gendered impact of the pandemic. And that's because we actually started seeing some interesting trends along the different quantitative data that we had. Some was in line with what we were seeing in other research, but some was perhaps a bit new or outlying. So that's what we put in that report. And the main function, of course, for us to do this research is to then make sure that we are able to adapt our programming, our current and our future programming. So just to give you a bit of an overview of what it is that we're looking at. So we look at data around social cohesion. So the research is really around how is the pandemic impacting social cohesion in these 6 countries. We're each very different, and some of them, while the pandemic was ongoing, also were facing very other challenges, like we had Palestine, we had Yemen, Nigeria, so some of these places are seeing a lot of security issues at the same time, which we also see come up in the data. But so some of the key things that we look at for social cohesion, we basically looked at 3 main indicators. First one being individual agency, second one being vertical cohesion, and the third one being horizontal cohesion. And so one very interesting finding that you can already see here in the graphs is that overall we actually saw overall levels of social cohesion increase across our 6 target countries. But if you look at a gender breakdown of that, that is mostly driven by an increase among men, whereas for women, we've seen more of a stagnation. And we'll see later in the rest of the presentation that is mostly driven by women's drop in vertical cohesion. And I'll come back to that later, but I'll hand it over to Samah now to present you some of the other findings around agency and horizontal cohesion. Samah, over to you.
Thanks, Hilde. Hi, everyone. Happy to join this platform to present part of the key findings of our report. Actually, based on the trends that Hilde just presented, those trends have actually resulted in gendered implication on the overall social cohesion. And through those slides, I'm going to present, and based on evidences from our data, we will talk in details about the key findings of this report. One of the key findings of this report is that women are among the first responders for pandemic response. And actually, despite women facing more barriers to get or access information about COVID-19, as access to accurate information for both gender groups is uneven, we see increased rates of women sharing information. And as you can see from the graph here, women started sharing information at a level of 49%, and this increased to 85%. We see increased rate actually of women sharing information, indicating their agency to raise awareness in their surroundings and communities. And important to say that at the beginning of this pandemic, we refer here to the first round of data collection, women rates of sharing information were lower than men. As you see from the graph, it was 49% for women and 56% for men. But over time, and in many countries, women began to share information more than men. And there were actually many contextual examples related to this increase in sharing information. So, for example, there were many efforts to strengthen access to women accessing information in a way that they can access information that meet their needs. In Uganda, for example, the government started to target women through door-to-door initiatives or activities where women with less access to information are targeted there. And this beside integrating women in discussions with Ministry of Health there. One other example, Search, for example, created a free hotline for women in Nigeria for those women who are seeking information related to their needs and concerns, because we have noticed that many women called and they had many questions about some particular and specific type of information related to their needs, like schools opening and impact of COVID-19 on that, some questions related to their maternal health and the implication or the effect of COVID-19 vaccine on that, and many other questions. So we have noticed that women in general have limited access to this specific or particular type of information through the traditional channels like TVs and radios. And also women are reluctant to express their actual needs or feelings in platforms where men speak more. Therefore, we see that women step in themselves to fill gaps in their needed information related to COVID-19, and this is likely to share information they knew or heard through informal channels. But unfortunately, there is a risk still there that this could be misinformation or rumor-based. Hilde, next slide, please. Another key finding, we have found that gendered concerns related to horizontal cohesion are worrisome. Actually, a search estimates horizontal cohesion through 3 different indicators: value and collaboration across divide, actual interaction, or making actual interaction, interacting actually across divides, and the level of feeling safe when interact in this kind of interaction. We see that both women and men, their overall horizontal cohesion has slightly increased between the different rounds, or mainly between the first and the third rounds of data collection. But still there are many gender differences. For example, women have fewer opportunities to interact across divide, and however, their levels of interacting across divide increase gradually over the time since the pandemic, but it's still lower than men. And at the same time, women levels of value and collaboration has not increased significantly since the pandemic. And in some countries, actually, this decreased. And this is it's indicating or signaling that women may be interacting out of necessity rather than their willingness to interact. While for men, and though they interact more than women, still the rates of actual interaction are low being compared to their level of value and collaboration, where their level of value and collaboration increased notably between the first round and the third round, for example. So this could be an indicator that men lack opportunities for this kind of interaction. Another important thing to be mentioned here related to the horizontal cohesion, that we are tracking a third indicator of feeling safe when interacting across divide. And in some countries, we have seen that this level for men is decreasing. And this actually resulted in a decline in the level of men value and collaboration. And next slide, Hilda, we will talk about one example. We see in Nigeria, for example, data shows that actual interaction across divide increased for both women and men, as you see from the graph. But we're looking at the level of feeling safe, the indicator we track to actually characterize this type of interaction. We see that rate of men feeling safe declined, while also there was also a decline in the level of value and collaboration for men. While for women, the level of feeling safe increased despite the decline in their level of value and collaboration. Nigeria is a country that is facing and witnessing violence and insecurity, and as men have more opportunities to interact more than women, maybe they are facing more risks during during their interactions with people from other dividing groups. Almost same trends in Yemen, which is also the country that is witnessing increased violence and insecurity situations since a long time. So we can say as another key finding that increased conflict and insecurity may impact horizontal cohesion for men more than women. Hilda, over to you.
Thank you, Samah. Thanks, and I'll just I want to take some time also to talk about our last indicator that we track for social cohesion, which is vertical cohesion, which, as you may imagine, is the one where we've seen the lowest progress across all the indicators that we track overall. And in a way, it's not surprising because in a lot of these countries where we're doing the research, mistrust in authorities is already particularly low even before the pandemic. And of course, the pandemic made it even harder for governments to respond to citizens' needs. So it's an indicator that we've seen move a little bit, but not incredibly lot. But what's interesting here to point out, and you see it on the graphs, is that this is really where we see a big discrepancy between women and men. If you look at the period September-November 2020, we found that women overall had a higher level of were scoring higher on the vertical cohesion indicators. And we measured that by asking a couple of key questions. We asked people about how satisfied they are with the services they receive from their government. We ask about how much trust they have in their government, that the government is treating everybody equally in the pandemic response. And we also got people's trust in non-governmental responders, so health workers and others, to what extent people feel that these health responders have their interests in mind when providing support. And so you clearly see that at the start of the pandemic, women had higher trust in the government, and they also had higher satisfaction levels with service provision. Men tended to have low. But by round 3, so May, July 2021, we saw a reversal in this trend. And you see that men start scoring higher. We see that in a lot of places, men were started being more satisfied with the services that they were getting, whereas for women, we either saw a stagnation or we saw a drop. We literally saw a decrease in satisfaction, and that also led to less trust in the government among women compared to men. So for us, that's a clear sign that the pandemic response efforts were failing to meet the needs of women in many of these places. And that's likely because women are not sufficiently integrated and they're not sufficiently part of some of the key decision-making bodies around the pandemic. So their needs were just not being accounted for. And we really see that play out. And just to give you an interesting example here, there's an interesting example that we learned in Uganda where there was a drop in women's satisfaction with the support that the government is providing. Because at the beginning of the pandemic, government was providing in-kind support to households. They were providing food aid, they were providing other types of in-kind support, but they switched that for reasons of logistics and being able to administrate. They switched that to cash-based support, which meant in a large majority of cases that then it was the man of the household. The women would tend to control the in-kind support, but the man, once it moved to cash support, it was the man who would control that and not necessarily always spend it on what women would consider a priority for the household. So we saw a clear drop in satisfaction there. And on the other hand, we saw good examples in Kenya, where the government quite early on at the national level decided that GBV services are considered an essential service during the pandemic. So that access should remain open, and women should be continue to allow to access those services. And especially in a couple of counties like Garissa County and others, there was very specific emphasis put on GBV response during the pandemic. And we saw that clearly reflected also in women's level of trust in their governments. So just to conclude on a couple of key recommendations from our research then. First of all, linking back to what I was just talking about earlier, I think that in a lot of places, there's still a long way to go in terms of incorporating women in the decision-making structures to avoid that their needs go unmet and that the response actually risks exacerbating certain gender inequities. We should also work with governments, and governments should be aware about this deficit in trust, especially among women, and how that may also play out in the vaccine rollout and things like that. So there's definitely strategies that are needed that need to specifically target women in terms of trust building. There's also a need, and Samah spoke about this a lot, about how women and men have different sources of information. They have different types of information that they're looking for in the pandemic, in the overall info atmosphere around the pandemic. And so we definitely need to become better at providing women with the information that they need regarding the impact of the pandemic on themselves, on their households, on the children, on their jobs, etc. And then the last point, our recommendation links back to the other point that Samah was mentioning around horizontal cohesion, where we see in a couple of countries this worrying trend of men actually feeling less safe compared to women, and this is around physical safety most of all. And so that can, of course, be a early warning sign for, well, it's already an indicator that there's violence going on, but there's definitely an indicator that more violence may be happening in the future, because there's a clear breakdown in terms of the trust that people have. And as the secondary impacts of the pandemic are becoming stronger, this is something that we may also see increase. So that's just something also to keep in mind. So just as a recap, we've provided again the links both on the Search website and on the Connexus platform, where you can find all the reports. Just to point out that all the thematic reports are also available they're available in English, French, and Arabic. The gender report is currently being translated into Arabic. It will be available soon. The French version is already out. And there's also Samah and my email address in case anybody's interested in more information or beyond the discussion now wants to ask any follow-up questions. So thank you, Jack. After that, so over for questions to you.
Great, thank you so much, Hilde and Samah. I can't wait to jump into this discussion. To our audience, thank you for joining, and this is now your time to shine. You can ask questions. A couple of notes about our formats for those of you who are unfamiliar with the Thursday Talks. You can submit a question in two ways. The first is through the question or chat function on your GoToWebinar dashboard. That will allow you to type your question. The second is to click on the hand icon. That hand icon will raise your hand and allow you to allow us to unmute your microphone so that you can ask your question live. When you do submit your question, we ask that you submit your name and affiliation. Just a note, these talks are recorded and posted on Connexus, so those who were not able to join us at this time can go back and listen to the presentation and the discussion. So I'm going to use my moderator's privilege here and say, firstly, there's so many amazing insights in this report. Like in Nigeria, the lack of opportunities for interaction corresponded to an increase in violence for men, the plateau in vertical cohesion amongst women, and the need to make sure that women are integrated within decision-making structures. There's so many fascinating things here that will be worthy of further discussion. The question I want to kick off our discussion on is, I find it really interesting that women were much more likely than men to share information, but were more likely to face challenges in accessing that information, and in particular, reliable information, which means they could have been sharing rumors or disinformation. Samah, I know this was your part of the presentation. I'm wondering if you could elaborate on this a little bit more.
Yes, Jack. Actually, we have noticed from our report that men are accessing more formal channels for information related to COVID-19. For example, in some countries, during the Friday prayers, there were some official officer nominated by Ministry of Health in those countries, and those official officers were presenting to people there accurate information about COVID-19 during the Friday prayers. But within those countries, actually the attendees of those prayers are mainly men, not women. So this is an example of how men can access directly formal and accurate information more than women. This could be happening in a different way in another country or another context based on the situation there.
Great, thank you so much, Samah. It's just super interesting that the information sources are different. Could you just elaborate a little bit more on the sharing of that information? Why was it that while men had access to more reliable information, that women were more likely to share the information they were receiving?
Be that women are trying they are stepping or trying to fill in themselves the gap in the available information, in accurate information they have, due to lack of or limited accurate information, and due to having particular and specific concerns that are not covered in media, in official media, or even in official discussions. Women are stepping in themselves to look for more sources, to find more information that meets their needs and their family needs there.
Great, thank you so much.
If I can perhaps add Jack, we didn't show that graph here now, but if you look at the report, there's an interesting graph where we compare specifically for Yemen and Palestine, the correlation between women's scores on the vertical cohesion indicators and the one around individual agency. And we see in both cases, these are in both countries, we've seen very sharp drops in women trusting their government's response for the pandemic. And at the same time, you've seen skyrocketing increases in terms of how much women are sharing information around them. And so they're really, like Samah is saying, they're really stepping into a void because they feel they're not being served. Either they're not getting information at all, or the information that is out there doesn't correspond to what they need to, or what they feel they need to know about the pandemic. So they've become much more active in terms of share. Like in some cases, we've seen like 98% of our women respondents say they actively share information on COVID with the people around them. And so what's interesting, of course, about that is we don't know, and we didn't ask that question. It was like, are you sharing are you sharing correct information or you're sharing rumors? We can't know that. But of course, there is the risk. There is the risk that since women, and especially because women feel like they're not getting information from the most reliable or institutional sources, that there is a risk that there's a lot of disinformation, misinformation circulating indeed. So just wanted to add that there is definitely a link between that low level of trust in the government and a very high need that women feel to share information with those around them, with the best intentions ever. I just want to add that that's for a lot of women, it's probably in the best intentions ever, even if it may lead to spreading of misinformation.
Yeah, it's the service delivery provider role, which many people will experience during the pandemic. One thing I want to discuss further is, you know, the sort of plateau in vertical cohesion amongst women is actually, I think, one of the most striking things that sort of you've shared with us today. You know, was there sort of any examples of the research of countries that did a better job of integrating women within decision-making structures, or integrating women within sort of I know governmental sort of structures in response to the pandemic than others? And what are there any potential sort of solutions to sort of addressing vertical cohesion beyond just, you know, integration? I'd love to know if there's just you came across any examples in the research.
So there is that example, Samah briefly touched upon it, from Uganda, where the Ministry of Health actually started proactively, and just to point out, Uganda in general is a country that scores relatively high on vertical cohesion, more so than in other places. And the government has taken a very proactive stance in terms of providing citizens with information, etc. And so they did at some point really, Samah, you can complement here, but they started doing like door-to-door visits to make sure that people were getting the information that they needed. And they really proactively included women in those door-to-door visits. So they would have female health personnel, community health workers, etc., that were part of that, which really just greatly increased the trust that women had in what the government was doing. So that's a good example, right, that we're seeing, and that can be done in outreach, it can be done in information campaigns. But I think it's also like there's the part about, on the one hand, there's the need to have women be part of an information dissemination strategy, but there's also really the other part where there's that need of, at the very high level, decision making at like, what does your pandemic response look like, and what are the services that you think your population needs, and how are you going to organize that? Where if you only have, in a lot of places, men sitting on those boards, or only very few women, there are obviously going to be needs that you're not going to be able to identify and not take into consideration, or you're going to have solutions like the ones that we've seen in Uganda, which then was a negative example in a way from Uganda, where they moved from this like in-kind to cash-based support. And those are blind spots. I think those are really blind spot in a lot of the responses that we've seen to date. So that's where that inclusion of women in the decision-making structures is so key, I would say, Jack.
Great, thank you, Hilde. One comment we have from our audience member, Dina Vatsani. Dina is from Libya and co-authored a piece of research on the impact of COVID-19 on women in Libya. And she said that she would love to share the research with you and the results with you. And I would say, Dina, we have a place for that. It's called Connexus. Anybody in the world can upload your resources, and we have a new women's peace and security thematic action area. So I'd encourage you to upload that information to Connexus, as well as reach out to Hilde and Samah with your work. I am going to go to my colleague Reem. Reem, I'm going to unmute your microphone so that you can ask your question live. So Reem, if you hit your microphone button, that should allow you to unmute. And I'd love if you could ask a question to Hilde and Samah about informal networks. You're still self-muted, Reem, so if you are able to ask, then great.
Now you can hear me?
Yes, we can hear you now.
Okay, great, thanks. So thank you so much, Hilde and Samah, for this wonderful presentation. I was happy to be to read through it and to be somewhat involved with it. But this came to mind that we spoke a lot about, you know, networking among men and how they really receive information from different sources, like, you know, sitting together at the cafe or when they go to Friday prayer, etc. And I was wondering, in any of the countries where that you targeted, were there any, you know, formalized network among women, something similar or something something such as meeting regularly on regular basics, or have the religious actors, for example, the religious clerk, try to reach out to women to keep them informed? So have there been any such initiatives? Thank you.
Samah, you want to take that question?
Sorry, Hilde. Yeah, sorry. I may be talking about an example from Uganda for women. Actually, markets in Uganda are operated mainly by women, and during the pandemic, during some specific period of time, those markets were allowed to operate though the lockdown measures, and that was a great opportunity for women from different groups to interact and to meet each other and to share their feelings and their perspectives. They actually spent nights together there. They were trying to avoid, for example, transportation costs, and this was a great opportunity for them to interact and to have this type of networking.
Great, thank you, Reem, for unmuting, and thank you, Samah, for sharing that experience or sharing that example from Uganda. I am going to go to my colleague, Xander Willoughby here. Xander, you've asked a question in the chat. Could you unmute and share that question with the audience?
Yeah, thanks, Jack, and thanks, Hilde and Samah, for all of your work on this research and for sharing with us today. I'm curious, and I feel like this comes up in a lot of COVID-related conversations, what opportunities or new challenges have these dynamics presented during the pandemic that we can integrate into our work, the way that we approach the world after the pandemic?
You're asking us, or you're asking the other members of the audience?
I'm asking you, but open to thoughts from the audience in the chat, of course.
I mean, I can take a stab at it, but I'd love to hear other attendees' opinion as well. I feel that there's a lot of opportunities that we could learn from. That's also one of the main reasons why we were conducting this type of research in the first place, of how to do things better in the future. At the same time, I'll be very honest, I'm not super optimistic about us being able to draw those lessons, because when the pandemic started and when we started with our COVID-19 response programming at Search, I read quite a bit, and I talked to a few people who were at Search heavily involved in the Ebola response. And a lot of what came out of the Ebola response as lessons learned were things that we could have applied during COVID, but we didn't. And a lot of it, there's a lot of similarities in terms of how do people in conflict-affected countries respond to the pandemic? How do they interpret it? Do they believe it? Do they not believe it? What's that issue of trust in your government? The gender differences, the way that the caring burden falls on women, the way that gender-based violence, like all of these things are trends that we've seen before, and we're seeing it again now. I mean, I'm in a way, I'm hoping that we, as an, let me call it an aid community, would do better at learning from COVID now, just because it's been at such a higher scale than Ebola perhaps was. But I think probably something that, and even I speak for myself at Search, something that we still struggle with is how do you, in an emergency setting, because especially in the early days of the COVID outbreak, it was really like an emergency setting, how do you effectively communicate with people who sit in the public health sphere, with people who sit on the humanitarian side of things, people who sit more on like the institutional health governance side of things, to make sure that these lessons get integrated. And I'm hopeful in a way, because like even actors like WHO now, they've invested quite a lot in like their pillar around health in peace, and they see the clear linkages. But it frankly remains, in my limited view on things, it remains quite on the margin. So I'm definitely open to whatever we could still do to improve that collaboration, because frankly, we as peace builders alone, we can't do this, right? We need just to find better ways to speak with those on the global health side of things. And we've had some of those conversations, but really not enough. That's what I would say about that.
I think I'd love to hear audience perspectives on sort of how do we improve coordination in response to these shared challenges. You know, Hilde, we've talked about it quite a bit over the last couple of years, is that, you know, one of the things that's inspired the Connexus platform is basically an interview I did with the Pole Institute in the DRC, where they were telling me, you know, they did not know what organizations were working on what in response to the pandemic in North Kivu. And I just thought it was fascinating, the lack of willingness to coordinate, you know, across all of these sectors that are technically working towards, you know, a shared solution to a problem that everyone is facing, and the inability to coordinate. So, you know, one of the things we really struggled with on Connexus over the first sort of 12 months was that ability to reach out across the public health sector and specifically, and demonstrate the value of peace building approaches. I think we can see things at the multilateral level and international level with the WHO, but it often became a more difficult conversation when we were talking with, you know, public health implementing organizations or research institutes that were sort of who we were targeting. I also have a hope that, you know, the pandemic has set us up to understand what a shared challenge looks like, and that's why, you know, Connexus didn't just become a, you know, public health platform. It's broadening its focus to climate change and technology and all these shared challenges that we face, to try and create those structures to improve coordination. And, you know, one of the biggest things we'll face is visibility in these different communities. But part of the slowness of the response to the pandemic was we had to build a lot of these structures. We had to identify the weaknesses. So going through that, experiencing that is, I think, hopefully hugely beneficial to us in the future. So with that, I think we're nearly at time for today. Only 2 minutes left. If you have any final questions for Hilde or Samah, speak now or forever hold your peace. But generally, Hilde and Samah, thank you so much for sharing this report to our audience. You will find the links to the reports in your chat function. You'll also find them on the Connexus website. So if you have any issues accessing them, please feel free to reach out to myself or Xander or Hilde or Samah. We will make sure that you get access to it. To those of you that shared information regarding, you know, reports that you have worked on or your organization have worked on, I would just encourage you to share that on Connexus, so that, you know, we all learn from each other's work. And don't forget, if you have a question that, you know, we didn't get time to address today, or if you're making dinner later this evening and all of a sudden it dawns on you that you wanted to ask a question, we have a discussion forum on Connexus to continue this conversation. So Xander has put that in your chat box right now. So feel free to go and ask a question, and we'll crowdsource an answer from the global community. We also will be back in a few weeks' time in mid-June for a Thursday talk on GIS for peace. So the next Thursday talk, so as you can see, geographic information systems for peace. We're going to have the sort of, I'm not even sure what DSSD is, Xander, but we're going to have Alliance for Peace Building and their partners, DSSD, to talk us through how they're using GIS, which is a mapping technology to sort of expand and improve the impact of the peace building field. So join us. You'll find more registration information in your chat box right now. And just a big thank you again, and we look forward to seeing you again soon. So take care, and thanks again to Hilde and Samah.
Thanks for having us. Have a lovely day. Bye, everyone.